Hello, my name is Dr. Aditya Kapoor. I'm a senior consultant orthopedic surgeon and the director of orthopedics at Omega Hospitals, Gachibowli. I specialize in joint replacement, sports medicine, revision surgery of the knee and hip, as well as trauma. I have been trained extensively in India and the United Kingdom and have done a senior fellowship in lower limb arthroplasty as well as a fellowship in sports medicine. So, what is osteoarthritis? Osteoarthritis happens when the wear and tear that happens with the knee outstrips the repair. As we know, when we walk, when we exercise, with any movement, there is a lot of load on the knee. In fact, there is 4 times the load of your body weight on the knee that normally happens. So you can imagine through your life and through multiple cycles how much stress occurs on the knee. What are the earliest manifestations of knee pain? Knee pain need not just be severe arthritis. It could also be when it happens with cartilage softening, what is called as chondromalacia, which is one of the earliest causes of knee pain. And this affects people of all age groups. Chondromalacia can happen also because of vitamin D deficiency and very commonly affects the kneecap. When the chondromalacia becomes excessive, then the cartilage breaks down completely and then it progresses further to arthritis. When should you see a doctor? Some of the first symptoms that you will see with knee arthritis includes pain, typically associated with stiffness. You may also find that you have difficulty in activities such as rising up from a low chair. You may find it difficult to sit on the floor. You may find it difficult to negotiate stairs, especially coming down the stairs. Getting into high vehicles, these are all common symptoms that may occur. Eventually, it may increase where you may find that the shape of your leg starts to change and you develop bowed legs. Additionally, some people can have tears in the cartilage, especially with the menisci, which may lead to symptoms such as locking. But these happen when you undergo a sudden injury that is associated when you already have arthritis. When should you see a doctor? When your pain is not subsiding despite simple measures such as taking anti-inflammatories, simple measures such as using knee braces, physical therapy. Despite all this, or if you have swelling, then it may be time to consult your doctor. What are the earliest investigations that can be done? The simplest investigation that aids the clinical examination and a diagnosis is a X-ray. The X-ray should be taken while you are upright and standing and putting load on the knee and must take care of all the compartments of the knee, which is why 3 views are required. Other investigations that may be helpful include some blood tests, especially if it is associated with an increased uric acid. Some doctors may test you for a test called as rheumatoid factor if you show symptoms of rheumatoid disease or if you're a known rheumatoid arthritis sufferer. Additionally, investigations such as an MRI may be carried out to see whether it is actually involving one compartment, multiple compartments, if it is only causing some cartilage defect that can be repaired. So these are some of the common investigations that are carried out. Your doctor may also carry out an investigation called as a scanogram. This is especially useful for younger people and we carry this out to see whether we can either postpone the need for knee replacement or to see whether we can correct your knee deformity. After investigations, what are the treatments that can be initiated? Initial treatment, should your arthritis be early, includes some medication, and these include a combination of chondroitin, glucosamine, some anti-inflammatory medication, and a combination. It is not just one medication that works, what we call as nutraceuticals. It's a combination. Now, does it work every time? No. It may work in some people and it may not work in the others. The theory behind taking these nutraceuticals is that there are some inflammatory markers that increase in your knee, as well as there could be some weakening of your cartilage, and the idea is to try and promote the integrity of the cartilage and reduce the inflammatory mediators in the knee, which can cause pain. Additionally, your doctor may also provide knee supports, bracing, and send you for physical therapy. This involves strengthening the knee muscles. As the knee muscles strengthen, it reduces the joint forces on the knee and reduces pain. We may also occasionally prescribe a walking stick to lower the joint reaction force and provide you support. What are the other methods in treatment? In early arthritis, we also recommend giving joint lubricating injections, especially of hyaluronic acid. And again, these may or may not work, but they have no detrimental effect. And these injections work well when given early. The theory being that in arthritic knees, hyaluronic acid reduces and this promotes more breakdown of cartilage in arthritis, and by replacing the hyaluronic acid, you can protect the integrity of cartilage. Additionally, we may also occasionally recommend cell therapy. We also recommend vitamin D supplementation, as it is known that low vitamin D can reduce cartilage integrity. The other treatments include, if the arthritis is severe, we may recommend surgery. In younger people in whom the arthritis has not destroyed the joint completely, we successfully carry out surgeries called as osteotomies, especially if the limb is malaligned. So, as we were alluding to, if we do a scanogram and your knee is not balanced, to put it simply, if a car tire is not aligned and balanced, it will wear early. Similarly, if your knee is not, or the lower limb is not aligned, it may wear early, and simple measures like correcting the alignment can postpone the need for knee replacements. What are the other surgeries that can be carried out? Well, one of the most successful surgeries that can be carried out is knee replacements, which has an excellent track record, either a total or a partial. Sometimes for people in whom we find that there is a focal cartilage defect, we successfully also regenerate the cartilage. These are some of the treatments, and the journey of a knee replacement patient is one, when dealt with appropriately and early, a very satisfying one, and can help you maintain your joint as well as activity for a very long time. Thank you.